Hi guys, welcome to the brand new series Beyond the Medicine, and we are here with episode 2, and it is a audio postcard series on YouTube that explore the option one can opt after MBBS. So we are here with Dr. Kashyap today, and is a UPSC CMS 2013 rank. He got UPSC CMS 2023 rank 241 and posted currently in CGHS Jammu. Here are some rules in the UPSC. If we can say it is a two session exam, first shift, second shift, two shift exam, and it is the only exam at the MBBS level in which you have to pass an interview also. A 100-mark interview is also given. You have to give, and interview is based on personality test as they mentioned in UPSC uh, information booklet. Okay, so the main thing about this exam is they have 1/3 negative marking for number, matlab assigned question number. Matlab it is not for all question. 1/3 is negative marking. So welcome, Dr. Kashyap. Welcome to my channel.
Thank you so much for inviting me and giving me this opportunity. Thanks a lot.
So how's you feeling? मतलब after ये UPSC it is like something मतलब UPSC थोड़ा फील करके थोड़ा अलग सा फीलिंग आता है मतलब एक इंडियन को मतलब IAS कैडर और वो वाला तो it is the same for UPSC CMS also.
Yeah, IAS cadre as such comes under the category of gazetted officers. UPSC CMS is a gazetted officer category as well. The perks, the basic salary, and everything is the same. But that kind of lifestyle which you see around for IAS officers, the gunman running and everything, that is not there in this job.
Okay, so power is there for you means मतलब you are head of something a hospital or you are just a doctor like same like others in every department.
So, when we join, we are posted as medical officers, and
Okay.
with time, there is promotions, and we become in charges of the wellness centers as well. In my
Okay.
case, I have been made the in charge. It's just the fourth month of me joining this, and I have been made in charge of my wellness center. So yeah, I actually am responsible for functioning of my wellness center smoothly.
Okay. So is it a dream to pursue for UPSC CMS?
It depends on what your dream is. If your dream is to have a very, you know, a lifestyle which is full of adrenaline rush and a lifestyle where you would just be working continuously and seeing patients getting better, then UPSC CMS might not be a dream for you. But
Okay.
if you have a dream of having a good work-life balance, if you see your work just as your work and not everything, then UPSC CMS should definitely be in your bucket list because this
Okay.
is a job which gives you a good work-life balance, a good salary, and a good position to work on.
Okay. So मतलब it was your not dream to pursue. मतलब it was not your dream
I would
or you
say that,
planned for it.
okay, so the thing is, I got to know about UPSC CMS from one of my friends who wrote the
Okay.
exam in 2022. From there, I read about what all UPSC gives to your life, and eventually, I became very serious aspirant for it. And yes, UPSC CMS, when I was giving this exam, it was a dream for me. And I'm happy that I have cleared it and I'm working what I wanted to do through this.
Okay. So NEET PG is never in your bucket list. Was never in your bucket list.
I won't say the exam NEET PG was in my bucket list, but post graduation was definitely in my bucket list. Clearing UPSC CMS does not mean you would never become a postgraduate in your life. The government never said that. You
Okay.
can pursue post graduation. If you are a postgraduate, you can go for super specialty as well. Nobody is
Okay.
bounding you to just be an MBBS doctor through CMS.
Okay. So one of my friend is working in army. He's a army man. Through मतलब after MBBS. So there is a rule that after 5 years only you can go for study leave. is there such a rule in UPSC CMS that any foundation that after 2 years you can go for NEET PG, and if you will go to earlier you have to leave the job. Any
Okay,
such rule
so
exists?
yes, so yes, this point needs to be clarified. Once
Okay,
you have cleared this exam, but you have before you getting the appointment letter through UPSC CMS, you are not pursuing NEET PG or you are not a resident, then
okay,
you have to leave the job in order to pursue that, in order to pursue your residency. But if you are already a resident while you have given this exam, you can continue with your residency and give extension. Or if the exam result of NEET PG has already been announced, you can apply for extension and you would get that in most of the cases. After you complete your residency, you have an option to either come back to CMS or to whatever you decide to do with your life. But if you are into CMS in MBBS and you haven't applied for extension, then you have to at least do the probation period. And after 3 years, the probation is usually for 2 years. After 3 years of that, you get a chance, or I would say extension, to do post graduation along with an opportunity to utilize the government sponsorship quotas. After
okay,
5 years, you can apply for study leave. This is in regards to CGHS. There is another cadre which is called railways. In
okay.
railways, after 1 year of getting into the service as a post MBBS
One
student,
year mean after probation period, 1 year.
within 1 year,
Okay,
joining
within
within
one year.
1 year, you get a DNB sponsorship. You can pursue for
Oh,
DNB.
okay. In railways.
Yes.
Okay. So, matlab, there is paid training is given to you for join before joining. Like in the UPSC IES cadre, training is there for 2 years. So, is something there is to handle the all the job and all the workload.
Hmm. First of all, I'm not very sure that training in IAS is for 2 years.
It is sure. I'm
But
sure.
no, the probation period I think is of 2 years. In UPSC CMS, you are given training, but that training is given batch wise. UPSC CMS,
Okay.
for example, last year around 1500 candidates were there. 1250 to 1500 candidates were selected. They are given batch wise. So you attend the training batch wise, and after completion of the training, you join back in your respective postings.
Okay. So, one of junior asked you, what is the time of getting appointment letter and joining? How much time is given in
Hmm.
between that?
Okay, so I'll tell you about myself. So when I applied for this examination last year in 2023, it was in July 16th, as far as I remember, one of the Sundays. And
Okay.
after clearing the theory examination, my interview was in the first week of October.
Okay.
The result was declared in December. Again, I
Okay.
think in the first 2 weeks, the final result. And I got an appointment on 1st of March. If you,
Almost
yeah,
9 to 10 months. Okay.
I from July to March 1st, yes. Because it is a
So,
two-step process, right? If they had
yes,
to
yes,
select you through a written examination itself, they would have given you the appointment letter by October or even
yes,
before that.
yes.
Then interview also there, that is in batches. You cannot interview, like, if there are vacancy is X number of vacancies, the number of students who are chosen for interview is three times of those vacancies
Yes, yes.
approximately. And you cannot interview all the candidates altogether because there is limited number of board members, like the way you
Yes.
have seen in series of uh, IAS related series, those boards, the same boards we have in UPSC
Okay.
Bhavans, which sit and interview us. So it is in batches itself and it takes time. Every day there are around 200, 250 candidates who are interviewed, as far as I
Okay.
remember.
Okay. So, how was your interview experience? What they ask?
My interview experience was a mix of emotions.
Okay, why so?
That day I cannot forget because that was one of the only days in my life where I felt, you feel
Nervous.
something amazing, but at the same time you feel, did I do terribly wrong in this interview? It was that for me.
Okay.
And when I was given in, my interview was in October first week, and there were around four or five boards. In each board, there is a UPSC commissioned officer, which is either an retired IAS or IPS officer, and there are professors
Okay.
whose identities are not revealed. I'm sorry, whose identities are not really revealed, but they belong
Hmm.
to specific subjects like clinical subjects.
Okay.
So when I entered the Bhavan, UPSC Bhavan, that marvelous building,
Nice.
and I was put into that line of candidates, and I was the first candidate to be interviewed. I went on to
Oh,
give my interview, and I just cannot forget those 40-45 minutes, what happened with me. The kind of questions, the kind of stress, the kind of tricks they play, I don't think anything else tests you on that. From your expressions to your answering to your tone, I remember that IAS officer, who retired respected IAS officer who was interviewing me, had at least 5 or 6 times seen me from my hairs to my shoes. Like he
oh,
judged me how I was answering, what was my response, everything. How were my shoes? How were my hands? How was my walk while coming in, while going out? Everything I could feel that he was watching each and everything. And there were respected questions which those faculties were, throwing up with all those tricks and everything they were giving.
okay. So clinical question is more there.
The clinical questions are definitely more.
Matlab
They
there is
were
no
related to the. Yes, yes, please tell.
just no rattafy question like from biochemistry or anatomy. True?
No, 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 no. What was the first question he asked me? Like, whenever you will go for interview, you will prepare a specific set of questions, right? This
Yes.
is the theory syllabus. I would read this.
Yes.
And this is the pH of my, like, example of what was my related to. The first question, I thoroughly prepared for those interviews, what I would do, what I would say. You know what was the first question that a respected IAS officer asked me? He
What?
asked me, "Can you tell me the full form of pH?" I
pH.
I was literally shocked. These are questions which test your stress taking capabilities, right?
Okay.
So I knew just H stands for hydrogen. P I was not sure of. And in
Okay.
UPSC, what I had prepared was, you are never bound to say half answers that I just know H, I don't know P. So I just said
Okay.
very humbly that, sir, I am not able to recollect. And then he kept on asking, what is the pH of urine? What is the pH of gastric content? What is the pH of semen? What is the pH of every fluid you have in your body, right? Blood. And what is the importance of those pH? Why pH is
Oh,
basic? Why pH is acidic? These questions
okay.
were asked in. He asked many questions. He asked about my roll number, everything, and then went for the surgery part. The surgery part, it was related to shock, trauma, and crush injuries. It was related to all these things. How would you manage if
Okay.
you see a patient like this on the roadside, and how would you manage if you see in the hospital settings?
Okay.
It was very clinically oriented. Third was um, medicine. Oh, medicine, ma'am, just tricked me so much. I can't tell you. She asked me, Kashyap, in which month are we? I told ma'am July. No, no, I told ma'am October. So she told,
Okay.
what are you seeing around nowadays? I told ma'am, COVID cases were increased and are still going on, maybe. She told, yes,
Okay.
definitely. But what else? And it was in Delhi. We were in Delhi, and there were a lot of increasing cases of dengue. So
Okay.
she was asking about dengue. Then she tricked me so much, which is the harmful serotype among all those four serotypes.
Oh,
And when I said, ma'am, NS2, she kept on, tricking me. Like, are you sure? I think you are wrong. Can you repeat it? Can you think again? Then she
oh,
pointed out to the surgery professor. Ha ha ha. Like she was literally, they both were having a laugh and saying, I I think this guy is wrong. And she was like, I'll give you the last chance. Tell me. I told ma'am NS2.
okay.
These were pressurized questions, very stressful questions that were happening. And then it was OBGY. I can't tell you the kind of case scenario she gave. It was it was like you had nothing in your hand, and how would you manage the case? It was like that. You were in a place where there is no table, there is no examination thing, there is nothing. You just have medicines. What will you give? Or you don't have even medicines. How will you manage this case on your own? You don't have any equipments.
Okay.
These kind of
So
questions.
each, मतलब, in interview, each subsection, मतलब, from each specialty branch, you have asked question like medicine,
Yes.
surgery, OBGY.
Yes, from see, it depends what kind of professors you get. That is why they are not revealed, because it is a, I would say, a chance. Some people get PSM, some people get ortho professor, some people get pediatrics. I got
Okay.
surgery, medicine, obs and gynae.
Okay, these are high yield as well.
These are
Imagine
high.
something, someone is getting ortho and he read only BTR.
But they test your basics. I won't say that they test your very hi-fi knowledge. UPSC is about basics.
Okay. So, what is the time schedule of the job? Like, you have to attend the emergency also.
My timings are from 7:30 in the morning to 2 p.m. in the afternoon, and
Okay.
it is working from Monday to Saturday.
Okay.
As of now, because there is shortage of staff in my area, because we are just two doctors in my wellness center,
Yes.
there is no night duties. But there are night duties in other centers where you will see there are VIP duties and everything in Delhi and
Okay.
other places where there are many medical officers. So
Okay.
emergency as such is not there in UPSC CMS, because it is, if you are posted in a wellness center, you would see OPD cases.
OPD.
Like
Okay.
everyday kind of medicine OPD cases where you will have many diabetic patients, many hypertensive patients, such kind of patients, like complaints of headache and everything. So it is kind of that in a single day. 7:30 to 2 is the usual timing. But I
Okay.
am since an in charge, so my work is slightly extended, like till 3 or 3:30 my work is there.
Okay. So, just like in many exams, they say you have chance to choose a cadre. Like there are many cadre, the railway,
Yes.
Delhi Municipal, NDMC. मतलब, I don't know about NDMC full form also. So, what is this NDMC all about? Someone asked
New Delhi
in
Municipal
question.
Corporation.
Okay,
Yeah,
it's
yeah.
a full form of New Delhi
So,
Municipal. So there are cadre different.
yes, yes. So, what is there that whenever you clear your theory exam, you
Okay.
have to, before interview, like in IAS, there is also DAF, Detailed Application Form. It is a very long form, I think 8 to 10 pages form, which you have to fill. You have
Okay.
to write everything about yourself, everything. And in
Okay.
that only, there is an option of either choosing category 1 or category 2. Now I'll
Okay.
let me explain you about what are these
Mm,
categories. Category
okay.
1 primarily stands for CGHS, Central Government Health Services. For us, it is
Okay.
CGHS. Okay.
Mm,
So in this, you majority of the vacancies are of CGHS. This time I saw many vacancies of Ministry of Labor as well in it, in category
yes.
1. In
Okay.
category 2, you have an option to choose either railways, prioritize either railways, NDMC or MCD. So basically, every cadre has their own perks. For example, in CGHS, your perk is a good work-life balance and to explore. CGHS is known for that. In
Okay.
railways, you have a very typical officer-like feeling. You know, you are a railway officer. That is a very,
Okay.
very prestigious thing in itself. And
Okay.
NDMC and MCD, they are basically known for NDMC has a very few vacancies. They are
Okay.
very known for capital restricted vacancies. Like you will be posted only in Delhi,
Okay.
right? You can't be posted in peripheries. You cannot be posted in other cities. You will be posted in Delhi. So if
Okay.
you are very certain that you want to stay in Delhi for your rest of your life, enjoy your life, these options are good for you. So it is to each their own what they want to choose.
Okay. So I think railway is the best. मतलब I listen from somewhere कि they are giving 5 tickets, मतलब 2 visits of whole India anytime you can take in year, and special reservation for your family members in railway.
Yes, all these perks are there. In CGHS also you get allowances for traveling, and I think every year or two, and every fourth year you have a very good uh, LTCs. Those are called LTCs, and you get
Okay.
in this also. But yes, railways itself is a very, prestigious thing in the
Yes.
society as well.
So can someone practice outside after doing job? It is possible.
Okay, so let me clarify this. A lot of people ask me this as well.
Yes.
Any central government doctor, they are given
Okay.
NPAs, non-practicing allowances, in which they are not allowed to practice
Yes.
outside their work timings.
It
So
is compulsory. Like
yes, if you practice, it is illegal and it is unethical. So it is like that. NPAs are given, you are given allowance not to practice, but if you are still practicing, it becomes illegal.
okay. So you have got your accommodation there.
I did not get my accommodation here because my hometown is Jammu itself, and my workplace is hardly 3 to 4 kilometers from my home.
Okay. So
But
मतलब accommodation is there.
accommodation, see, accommodation and everything is very relative. If there is
Okay.
accommodation, they will give you. If there are no vacancies for accommodation, they won't give you. Few of my
Okay.
friends have in CGHS, they have got a very, very lavishing 3 BHKs to live
Okay.
at a very minimal cost of HRAs.
Yes.
But there are other people also who have not got, but they will get sooner or later, depending upon the vacancies which are created, or
Water is
the,
available or not.
yeah, availability, I would better say. So it
Yes.
depends on that.
So just like, is there any chance कि you who are posted in an area there is hard to get accommodation?
Hard to get accommodation, I would say. For example, take
Means
my example only. Here in my area, Jammu and Kashmir, CGHS is expanding, but it is very less relative to other metro cities, right? So
yes.
accommodation here is less because I have not actually heard of any accommodation being provided here, or maybe it is
Okay.
not in my mind. But like very far off areas where the reach of central government is less, there could be slightly lesser chances to get those accommodation. But there is in CMS, you are posted, CMS Combined Medical Services, you are posted in metro cities mostly in Delhi, and Delhi is full of CGHS. So
Yes.
sooner or later you will get that.
Okay. So uh, is there any chance to choose cities like मतलब someone is picking railway and I have to take only Jaipur, or I have to take only my city,
Absolutely.
Chandigarh.
Ab- Absolutely.
So
So
it is after interview it is this chance is given, or before the interview, or after
very,
result it
very,
is given.
very valid question. Thank you for asking this question, because this is a very common concern for everybody. Like somebody is from Bangalore, he's posted in West Bengal. So he will get concerned about when he will come back. So
Yes.
the best answer I can give is UPSC CMS does the very best to post you wherever you want to get posted.
Wow.
In interview, you are given a sheet in which you have to fill your primary details, including your name and roll number. Along with that, there
Okay.
is a column where you can give your preferences up to three. Like
Wow.
this is the city, this is the state, this is the city, this is the state. Up to three you can give. And
Okay.
amongst those, CMS tries the best according to the vacancy, according to the I would say your rank, which
Okay.
to provide you that availability of posting. For example, in mine, I gave Bangalore, I gave Delhi, and I gave Jammu.
Okay. And
Along
you
with
got
that,
Jammu.
and I got Jammu, which is my hometown.
अच्छा मतलब they saw hometown also.
Yeah, yeah, yeah. Absolutely. They would see their administrative work as well, right? If there is
Yes.
shortage of doctor in Jammu, there is shortage. There is very much shortage. My OPD is around 150 and we are just two people. And since I am an in charge, I have to look everything else as well. So there is huge shortage of doctors here. If there is shortage, and someone has put up Jammu in their preference list, they would prefer him over there, right?
Yes. Yes.
But
Mm.
there is another opportunity where you are given that during appointment, if
Yes.
you are not satisfied with if you are not completely satisfied and you are like, I won't join if I am not given this city, or if I am not at least posted in this major city, then you can
Yes.
reply to them and tell that I want this city and I would wait till any vacancy or further confirmation is cleared from your end. You can
Okay.
do that.
Wow.
Many people
Amazing.
have got changed in their cities, many people. And if not, at least Delhi, because Delhi is the capital center for your commute, right?
Yes.
आप दिल्ली से कहीं भी travel कर सकते हैं एयरपोर्ट से.
Yes.
So at least Delhi they have posted a lot of people, and other places also where they wished for.
Amazing. UPSC is so amazing. In 250 rupees of paper. So what about your
Actually, not even
salary?
250. I think it is 200 rupees for the
Oh
application
yeah,
fee.
200. Yes.
With
So
the so amazing the way they conduct their exam, offline conduct, no scam. The exam is
no
not being
paper
spread
leak,
to,
no
yeah,
telegram leak.
no paper leak, no telegram leak, interview, everything in just 200 they give. See, so this
Okay.
is a very beautiful thing.
Okay, so for my fellow listener who are listening, Dr. Kashyap has his own channel in YouTube by Dr. Simplified, where he posts bites of about his UPSC preparation. You can follow that, Doctor underscore Simplified. You can follow that in
Thank you so
YouTube.
much for sharing.
So what about your salary portion, Kashyap?
Okay. So, through CMS, you are posted in different locations, right? And
Yes,
all the cities of our respected country, India, is categorized into X, Y, and Z city.
that's
X
for
being
HRA.
the X, X,
नहीं,
Y, and
मतलब
Z.
this XYZ is for HRA only, I think.
Yeah, yeah, yeah. According to the HRA, it changes. The total
Yes.
amount of salary you get, it changes.
Okay,
So,
so in
yeah,
hand
one
around
of, yeah, so just tell me.
in hand money in hand actually
Okay.
people ask about it कि in hand कितना money आएगा.
Exactly, I will tell everything, every detail. There is nothing to hide. So
Yes.
if you are posted in X, like one of my friend is posted in X city, there his total gross salary is around 1.30. In hand, he is
Okay.
getting, as far as I know, is 1.1 to 1.16 lakh per month.
Okay.
I am
Okay.
in Y city, it's Jammu, so the HRA is less. I get a gross of around 1.20 lakhs per month,
Okay.
and in hand I get is 1 lakh rupees after deductions of new pension scheme of around 10,000
NPA. Hmm.
NPS, and also the income tax. So what I
Okay.
get in hand is around 1 lakh. in the 7th pay
So,
commission.
yes, UPSC CMS have any benefit in medical service? Like in Rajasthan, they have different plan for government people.
Can you repeat this? I didn't understand this.
Like in Rajasthan government, there's someone who is working in government sector. They have free OPDs and all. So you have any benefit for being a central candidate?
Okay. Yeah, yeah. Okay. You are telling about my own benefits, health benefits.
Yes.
Okay. So this is the best benefit of being a central government employee, especially a gazetted officer, grade A officer, that you are entitled for CGHS cards, right? Central Government Health Scheme cards.
Okay.
In that, you are given everything free of cost. For
Okay.
example, your OPD treatment, you want to visit the best of the best super specialists, you can go and
In
visit
any hospital?
in empaneled hospitals.
Okay.
In empaneled hospitals, and trust me, all the major hospitals which you have heard of are in CGHS empanelment. In Delhi, Fortis Hospital is there. Fortis
Okay.
Hospital, BLK Max Hospital, all these big hospitals are in empanelment with CGHS. So this is their OPD services, test all those tests and investigations and all the routine medications. Touch wood not, if someone gets very chronic disease like cancer, all the cancer medications which are like lakhs and lakhs in rupees, you get free of cost.
Oh,
And
okay. So,
for serving people, every month there is deduction of around 600 from their cards,
okay.
CGHS, for this CGHS cards. And if
Okay.
you have your parents dependent on you, there are certain conditions for that. Then
Okay.
they can also avail those benefits along with you. Your family would be entitled. Your family in terms of you, your wife, and your children.
Okay. So, last question, second last question. Are you satisfied with your job? You are plan for like I have to do NEET PG always in mind. Many people have question कि सर यूपीएससी तो निकाल लूंगा लेकिन फिर नीट पीजी करना जरूरी है क्या? Like
Okay.
feeling like this. मतलब like simple question is you have pain or paper like job or like you see patients.
Okay, can I ask you in return of this? A very simple question. Okay, suppose you are ill and you are a
Okay.
non-medical, right? Let's
Yes.
consider that. Someone in your family or you are ill. If you have a opportunity to get consultation free of cost from the best of the best super specialist free of cost versus an MBBS doctor, what would you prefer yourself?
Obviously super specialist.
Right? The same
Even
is
if
the thing with,
it is paid.
yeah, the same is the concept of cons in UPSC CMS.
Okay.
We do see patients, but that has to be developed with trust and time. I
Okay.
see around 50, if there are around 50 patients, few of them are already some follow-up cases of another doctors, right? Who comes
Okay.
for just routine medications. But with time, if you prove your communication and your effectiveness well, there are
You
patients who
can
become
diagnose.
patients of yours.
Yes. Yes.
You can definitely diagnose, and the patients would themselves start trusting you. If they see that इसकी वजह से तो मेरे को फर्क पड़ रहा है, तो मैं क्यों किसी हॉस्पिटल के धक्के खाऊं?
Yes.
वो भी होता है.
So like in your wellness center, all major investigations are free there. I thought so.
See, in my wellness center, I would tell you what all happens, right? Me
Okay.
being an in charge, first of all, I have to go and make sure what all pending medicines of the which were not available in our center at that point of time, they are timely procured by the patients. So I
Okay.
have to contact locally with the pharmaceuticals as well. I have to
Local
ensure that
pharmaceuticals means
with the
you
tell me.
I mean that government don't like in the Rajasthan they send the bulk of medicine you are lacking of. In UPSC, it is not like that. You have to contact the local provider.
Trust me, in my center, there is medicines worth of more than crore
Oh,
right
yes,
now.
I know.
Okay. So,
मतलब they are giving it my मतलब you have to buy from your local provider. मतलब I
no,
have to
no, no,
ask
no,
it.
no. If, see, there are medicines, a lot of medicines are there. Every stock is there, but that stock also gets emptied with time, right?
Yes.
If so, then you have to again purchase that. Purchase that in the sense you have to ask the government that I need these medicines, and then that comes in bunch. This happens in that
Okay.
cycle. So
Yes.
in
Yes.
between that cycle, if the medicine is over, so the government has made certain pharmaceuticals entitled to provide medicines to us as well, so that the
Okay.
patients do not suffer, right? This is a very good
Yes.
thing
Yes.
from the government's end. So
Yes.
I
मतलब
do
it is
that.
very good in
That
central
yeah,
thing.
yeah. That at least the patient gets the procured medicine on time. Then there is definitely OPD in which there are patients who are already routine patients of hypertension. For example, a patient is having is a hypertensive patient. You check for the blood pressure. The blood pressure is under control. You advise him to take the same medications, and if it is not control, you can advise him to either you can counsel him regarding the diet, or you can change the medicines according to
Yes.
your need and the patient's consent. Then the
Yes.
patient, so these are the follow-up patients which eventually become yours, and with the
Yes.
word of mouth which become yours. There
Yes.
is a bunch of I have a patients who wait for me to either come to the my desk after making sure everything is running well, to come to back to my desk and start my job again of seeing them. So there are patients like this also. Then there
Okay.
you can, and you have this greatest opportunity to prescribe any test, any investigations which you wish for.
Okay.
Like
And
there
they
are
can do it from anywhere.
they can do it from the empaneled hospitals or laboratories, right?
Okay.
Which are under empanelment. If they do not get it done, they can still claim for reimbursements. There is still an option for that. That is very details of getting into CGHS. It is very detailed thing.
Okay.
So it is like that. So eventually you see patients also. You learn from
Learn also.
learn from these patients as also, as well as other patients who are follow-ups of other super specialists.
Yes.
If I see what this super specialist, why he has changed the medication, why he has prescribed this test for this, you learn from that also. So it is a continuous
Yes.
learning process as well. And the biggest learning from me through CMS is public handling. This
Yes. Yes.
the you the patients are not just patients as such. They are very knowledgeable patients, right? They are
Yes.
themselves central government officers. They have been retired IAS IPS officers, so they have
Yes.
knowledge of medications, or they are interested in their own treatments as well. So you have to be on your toes.
Yes.
And
Yes.
every 15 to 20 days I have a meeting regarding what all we can do to improve our services with the
Oh,
committee members, who are, one of them is very respected retired Director General of Police of my state, of my union
okay.
territory now, and secretaries. We discuss, if we have a meeting of around 40-50 people every second week, and we discuss what all needs to be improved, what are the grievances of the patient. So this is the public handling which happens.
Okay. So one of the question that I become curious that in over department like in Rajasthan the in charge of hospital have to send various data also that what is the vaccination in your center, what is this, what is that, send us the full chart, send us data about it. So you have to do that also, or the other PSCO CSCs are covering that.
See, I don't have to do that because there is a very brilliant website which automatically uploads that. If I'm
Okay,
seeing a patient, it automatically gets uploaded that from my wellness center or from my area, how many number of medicines have been given today.
okay,
Or all this is what I have to do is I have to sometimes bill. I have to send the billing that this medicine which was procured from outside, the local
Okay.
chemist, this was the bill. I have to sign, give it back to the pharmacist, and they only get it done. I don't have to do much headache upon that.
Okay. So
And
no
yeah.
databases means no
Mm,
Excel sheet like
no, no, no. Since the time I have joined, I haven't done anything like that, and things are working very smoothly. You don't have to
okay.
do
Good.
Excel sheets and all. Can I
Okay.
add one point here?
Yes, yes.
Okay, so many of the aspirants, which you also pointed out that if I am into CMS, then I will just be like an MBBS, right?
Yes.
Becoming or not becoming like an MBBS is up to you. The government is providing you an opportunity after 3 years to pursue PG without any much
Yes.
hassle if you use the sponsorship quota as well.
Yes.
If you utilize that, you become a postgraduate, there is no need for you to come back to the same wellness center.
Yes. Yes.
Get posted in the hospitals where CGHS wings are there. If you go to Safdarjung hospital, my medical was there. My medical
Yeah.
examination the next day after interview was there. I was
Yes.
astonished seeing the CGHS separate wings. There is
Okay.
wings for orthopedics, there is dermatology, there is, as far as I remember, there is medicine, there is ophthalmology. All these things are there. All these wings are there in multiple hospitals. In Safdarjung, it is there. In Lady Harding, as far as I remember, is there. In RML
Okay.
hospital, it is there. And now it is collaborating with AIMS hospitals as well. So after
Oh.
doing PG, you don't have to come back to the same wellness center. And if you are feel very boring, you don't have to
Yes.
just
Yes.
do
Yes.
that. You just go into the hospital and start working over there.
Yes. So last and the most important question of this interview, this chit chat. Any specific book you want to suggest? Any specific thing you want to suggest to those who are preparing for UPSC CMS?
Hmm. So, since this time the exam is just on 14th of July, so I don't think
Yeah.
starting any new book from now would be a great idea to suggest. So, what I can
Then
prefer
those who are preparing for next year.
next year, right? So, I would not suggest any book because I haven't read any CMS specific book.
Okay.
And there, people say that there are various books such as Prasad or some other
Prashant.
new publications are Prasad, PRASAD, and
Mm-hmm.
certain new publications are coming up, but I never read them. The
Okay.
reason is that UPSC is always about the syllabus and its limits. UPSC is always in its limits in the syllabus, very
Okay.
concise. What I did was in my, can I share what I did?
Yes. Yes. Sure.
Okay. So my NEET PG when I attempted along with internship just in the flow that I got a very bad rank and I had around just April, May, June, July. I just started preparing for it around 1.5 month before the exam itself
Okay.
because I was not knowing about the perks of this examination before. When I filled up
Yes.
this form, I read about this exam and I got so curious to join this examination, to join this service. In those 1.5 months, I studied like anything. What my main focus was the PYQs and previous year topics.
Okay.
Every question I saw in the previous year question list, every
Okay.
option of that, I used to make a short note of it. Because if the
Okay.
examiner has given certain thing in the option, his mind was already occupied with that question which he has put in that
Yes.
option, right? Out
Yes.
of four
Yes.
options, one is correct, but other three he has put na. He hasn't just computerized it. There is no AI. He has only put
Yes.
those
Yes.
options in the list. So those questions were also in his mind. So I just wrote short notes of those options as well and read those topics which were asked in very great detail. In this way,
Okay.
with time, I think in a month or like 50 days, I was able to make a short notebook of myself which covered everything for the past
Okay.
7 or 8 years.
Wow.
I kept on revising that, revising that. and I just gave this examination and I cleared.
Okay. So no dams, no marrow, nothing.
I was a damn student for my PG, but when I did not find it very helpful for my CMS, I'll be very honest.
Okay.
Except for maybe OBGY, other things I wasn't very satisfied with my notes. Personally,
Oh,
personal opinion.
okay. It depends मतलब person to person.
Yes.
Okay. Okay. So thank you for having here, Dr. Kashyap. I think followers, those who are listening it, got answered every question. Still, those who are confused about question, they can answer from his. They can get question and answer from Dr. Simplified channel. Okay. Thank you, Dr. Kashyap.
Thank you so much. It was a pleasure talking to you. Thank you for inviting me.